So now we're going to talk about the stratified epithelium. So we said stratified means multiple layers. And this epithelium called stratified squamous epithelium is the most common epithelium in the body. And the main function is protection. Now, the stratified squamous epithelium are of two flavors. There is a keratinized and there is a non-keratinized. So when you talk about a keratinized, we are looking at the skin. Keratinized, stratified squamous epithelium is the outer layer of your skin. And the outer layer of the skin is called? Epidermis. Epidermis. Below that, what do you have? The dermis. Epi means above, epidermis, and the other one below that is the dermis. Okay? The peculiarity of a keratinized, stratified squamous epithelium, it's a mouthful, is that the surface cells are packed with a protein called keratin. That's why it's called keratinized. And why do you need keratin? It makes the skin waterproof. So you're not losing water all the time. Otherwise, you're going to be dehydrated and you're going to be always in need of water. Also, the cells in the skin are constantly renewing. So what happens at the bottom layer of the skin? Cells are being produced continuously. They are moving up. And as they move up, they push the next layer up. And as it goes up and up, the surface is desquaming. That's what we shed as dander. So it's constantly renewing. And finally, it flakes off or it exfoliates. So that's about keratinized. Now let's go into the second one, which is a non-keratinized. Again, it is seen on the outer lining of the mouth and the esophagus. And usually it's seen in moist areas. So that's why it's seen in the mouth, the trachea. Trachea produces a lot of mucus. That's why you always do this because it's a lot of mucus production. Also seen in the vagina. So the non-keratinized squamous epithelium can resist a certain amount of stress or abrasion. But since there is no keratinized layer, it is not waterproof. So that's a big difference. Now let's look into stratified cuboidal. This is usually seen in the sweat glands, ovarian follicles, seminiferous tubules. It's seen in very specific locations. It's not very common. But you see two or more layers of cube-shaped cells. And then there's a transitional epithelium. Transitional epithelium is seen only in the urinary bladder, urethra. That's where there is when urine accumulates in the urinary bladder, the bladder enlarges. And what happens is that these cells are normally rounded. So when the bladder enlarges, they change their shape. They become flat. So they have this peculiar capacity for changing shape. Which one?
Isn't that when it open when it gets full?
Well, actually, it doesn't open.
Like, instead of
Yeah, well, there could be gaps, but basically epithelium always are adherent. And we're going to talk about this junctions between them because it's a lining. But yes, you know, especially in the lungs, you can see the simple squamous epithelium. There are areas where there are gaps between the two cells. That's what you're talking about, right?
no, I'm saying I thought there were some cells that like your cells in your bladder are like this, and then when the bladder gets full, they spread by flattening out.
Yeah, that's a transition.
That's what you're talking
Yeah.
about?
That's okay. Yeah, that's what we're talking about. So what you explained was a change of shape. So that's why it's called a transitional epithelium. It can change shape. And so it's like a stretchable lining, which is amazing. Okay. So we have talked about the epithelial tissue. Now let's move into the connective tissue. Connective tissue is the most abundant tissue. And this, if you think about the cells in a fetus, they all come from 3 layers. So in the baby, when the baby is forming, there is an ectoderm, that's outer, and there's a mesoderm, which is the middle, and there's an endoderm. So the ectoderm is what becomes the skin, endoderm is the lining of your gut, and the mesoderm is what's in between. Okay. Oh, I have to stand here in order to be in the range of the mic. So connective tissue means, unlike the epithelial tissue, it is like if you think of jello with some fruits in a jello, that's what it's like. So there are cells in a matrix. So the matrix is what I described as the jello, and the cells are the fruits. So you're eating jello with some fruits inside, and you can compare the matrix to the jello, compare the fruits to the cells. Epithelial tissue is not like that. It's like a lining, okay? They are connected to each other end to end. Well, here it's different. So you understand the configuration. And this matrix has got fibers and ground substance. So what's the function of the connective tissue? It connects organs. It supports the body. For example, bone is a connective tissue. Cartilage is a connective tissue. They connect the bone. I'm sorry, the other connective tissue is tendon. Tendon connects muscles to the bone, and there are ligaments, another piece of connective tissue, and they connect bones to bone. And the bones and cartilage support the body. The bone protects vital organs. For example, the skull protects the brain. The ribs protects the lungs and the heart. Okay. Again, immune protection. The white blood cells in the blood. Blood is a connective tissue. Why is blood a connective tissue? Because it fits with the definition. There are blood cells in a matrix, which is the blood plasma. Muscles, connective tissue. Muscles move the body. We said blood is a connective tissue. So what are the types of cells in connective tissue? There are fibroblasts, macrophages, leukocytes, which are the white blood cells, plasma cells, mast cells. Mast cells are cells that secrete heparin, and they also secrete histamine. So that's why when you are bitten by a mosquito or when you're bitten by something, immediately you react because the mast cells are. They dilate the blood vessel. They cause an immune reaction around that area where you're bitten. So you start feeling itchy. Again, adipose tissue. What is adipose tissue? Adipose? Fat. Fat tissue, yeah. That is connective tissue. So these are the types of cells. And we said the matrix consists of fibers and ground substance, correct? 3 types of fibers. There are collagen fibers, which is the most abundant, 25%. They are strong and they are stretch resistant. They are seen in tendons and ligaments, also seen in the skin. Skin also has got a lot of collagen. Then there are reticular fibers. Reticular fibers are thin collagen fibers, but they are coated with a glycoprotein. They are seen in certain organs like spleen and the lymph node. So you probably saw these things in the lab. When you see the section of the reticular fibers, you can see them as bluish white little fibers. And then there are elastic fibers. They are thinner, very thin, but they allow stretch. Not only stretch, they have a recoil. What do you need a recoil? In the lungs. So you take a breath, the lungs expand, you want a recoil. So it goes back, right? So that's basically done by the elastic fibers. So we talked about strength, which is provided by the collagen fibers. We talked about a scaffold in the lymphatic organs. And we also talked about the elastic fibers, which produce that recoil. Again, I told you that matrix means there are fibers and there are ground substance. So the ground substance is what I described as the jello part of the matrix. So that's what fills between the cells and the fibers. So here you can see there's a lot of space here, and you can see there's a lot of cells here. But this ground substance, it could be watery. Where do you see watery ground substance? Blood, exactly. In areolar tissue, which you probably saw in your lab, that is where the ground substance is like a gel. In cartilage, the ground substance is rubbery. In bone, it's hard. Bone is connective tissue. It's simply because the matrix is hard. So we're going to look into the types of connective tissue. So we have fibrous connective tissue, 2 types. One type which is loose and the other type which is dense. So the loose one, I'm giving you 2 examples, areolar tissue and reticular tissue. So this is another thing you saw in the lab. You saw the areolar tissue, and that's a classic example of a loose connective tissue, which means there's a lot of spaces. There is, most of the cell types are seen here. You see collagen fibers running in random direction. This is the body's packing material. And nearly every epithelium of the body sits on areolar. I told you epithelial tissue has got a peculiarity. What is it? It is? Does it have a blood supply? Oh, it's avascular. It is avascular. Avascular means no blood supply. So how does the epithelium survive? It has to get nutrients. It is producing waste material. How does it remove it? By diffusion. So most of the epithelium rests on areolar tissue, and areolar tissue has got an abundant blood supply. Reticular tissue is seen in lymphatic organs. What are the lymphatic organs? Lymph nodes, tonsils, spleen, thymus, bone marrow, all of these are lymphatic organs. Now let's go into the dense connective tissue. When you talk about dense connective tissue, there's dense regular and dense irregular. Let's talk about dense regular. The dense regular is seen in the tendon. So here you can see this is the gastrocnemius muscle in the foot, and you can see it is attached to the bone here through a tendon. And if you take a section and if you look into it, this is what you're going to see. You're going to see a lot of collagen fibers which are parallel to each other. They are packed, tightly packed. And in between, you can see the nuclei. So this is the appearance you're going to see under the microscope. So some of you have done the lab. So in the lab, this is what you want to be looking for. You want to looking for these sheets of collagen fibers, and you see rows of nuclei. Dense, irregular connective tissue, which simply means, unlike the tendon, the collagen fibers are not parallel to each other. They're in different directions, which means they can withstand unpredictable stress. Where you see it? In the deeper layer of the skin, under the epidermis, under the areolar tissue, you see. So in the skin, if you see a skin section, you're going to see the epidermis where at the very top. Below that, you're going to see the epidermis always rests on a layer of connective tissue, usually areolar connective tissue. And below that areolar connective tissue, you're going to see the dense, irregular connective tissue, because the skin can peel, otherwise the skin will peel off. You do this, it'll come off. So it can withstand stresses like a Velcro. So this is what you're going to see under the microscope. You are going to see these collagen fibers, which are going in it's random, in different directions. Good for withstanding unpredictable stress. And below that, in the skin, you're going to see adipose tissue. Adipose tissue means fat. So why do you need fat? Energy, yeah, that's energy. It's your storage. Also, fat provides insulation, and also it provides a cushioning. And there's a type of fat called brown fat. Where do you see that? In babies, correct. So, and also you see that in hibernating animals. And that is what is used for producing heat. Let's move on to cartilage. Again, connective tissue. Tough, but flexible. Can you show me where, can you touch the ear? This is cartilage. It is tough, but it is flexible. full of collagen. And what are the cells that produce cartilage? Chondroblast. So anything which is chondro is cartilage. Chondroma is a tumor of the cartilage. So chondroblasts are cells which produce cartilage. So if you hear the word blast, that means it is producing the cells, okay? So a chondroblast is a cell that produces cartilage. Osteoblast means it produces bone, osteo.
Is it that anything to do with why your nose is cartilage too, right?
Yeah, your nose is cartilage.
So what, is that anything to do with why your ears and your nose never stop growing? I heard they never stop growing in your life.
No.
Ears and your nose.
No, they stop growing, but they are almost the same cartilage. Because that's one of the areas we take cartilage from if you want to do a nose job. We take it from the back of from the ear.
And it's not.
And it stops. Yeah, your nose doesn't get bigger after
I'm not saying. You look at old people, they always have huge ears.
Yeah, that can happen, but that is, you can have you know, some people, they develop a condition, what is the condition, where the nose suddenly, it becomes bigger, but that's because of subcutaneous fat. That's where we do a shave of that's very common. I used to see a lot of these cases. Yeah, I think it was mainly in Ireland. Yeah, there's a lot of there was an epidemic there, and a lot of people have these noses with a lot of subcutaneous fat conditions, which sometimes it becomes a little unsightly. So we may have to remove it. So yeah. Again, cartilage is avascular, just like, which is the other tissue we said is avascular. Epithelial, correct. Cartilage is avascular. So we talked about two tissues which is avascular. So when you say something is avascular, that means there's no blood supply, but it receives blood supply or nutrients, and all this happens by diffusion. But one big problem is that if there's an injury, healing will be slow, especially in cartilage. So cartilage is covered by a layer called perichondrium, and perichondrium contains blood vessels, and from there it has to diffuse into the cartilage. So we're going to talk about three types of cartilage: hyaline cartilage, fibrocartilage, and elastic cartilage. Hyaline cartilage, if you look at the a slide, it looks like glassy. And you can see there's a lot of spaces here, and inside the space there are cells. So these spaces where the cells reside are called lacunae. So lacunae, you see lacunae, and you see cells inside. What are the cartilage producing cells? Chondroblasts. Anything blast means producing. Examples of hyaline cartilage is articular cartilage. What do you mean by articular cartilage? That's a cartilage where you see in joints on the ends of long bones. So you have the femur here. Femur has got a head, and on the head there's a layer of cartilage, the end of long bones. And then you have costal cartilage. What is a costal cartilage? You know the ribs? Rib is bone, but the rib is connected to the sternum in front through cartilage. That's called costal cartilage. So the rib is connected to the sternum here, which is a bone here, and to the vertebrae in the back. So in the front, it is through a cartilage, and that's called the costal cartilage. Costal means ribs.
Intercostal.
Yeah. So anything when you say costochondral junction, yeah, that is anything it's connected with the ribs. So you'll come across these terms when you're in further classes. And this hyaline cartilage can also be seen in the trachea. Why do you need it in the trachea? Because that's an air passage. So you have to keep it open, right? If the trachea collapses, you cannot breathe. Air doesn't go in. So this cartilage holds the trachea open. And also in fetal skeleton, it's mostly hyaline cartilage. Elastic cartilage. The elastic cartilage, this is elastic cartilage here. You can see all these elastic fibers. The elastic cartilage contains a protein called elastin. It is very flexible. That's what you see in the external ear and also in the glottis. What is a glottis? So that is the start of your airway. So at the back of your tongue, it keeps going from there. It is going into the airway part of the system. Okay. So that's really where there are there's a division there. So the mouth, at the back of the mouth, there's one tube which goes to the stomach, and the other tube goes into the lungs. So sometimes when you're eating fast, food which is supposed to go to the stomach might go into the wrong tube. That's when you start coughing and you want to bring it out. Okay. That entrance there is called the glottis. So the glottis divides into two, and one part is going into the stomach, one part is going into the lungs. And when there is a hereditary defect of the elastic fibers, we have a syndrome called Marfan syndrome. A famous person who had it was Abraham Lincoln. He had Marfan syndrome. These people have hyperextensible joint. So basically your joint, if you do like that, your joint stops here. But if a person has with Marfan syndrome, they can keep moving it further. And if you do this, sometimes it stops like this. Some people can bring it back. So it's more extended. It's a hyperextendable condition. It's because of a defect of the elastin fibers. Fibrocartilage. Fibrocartilage is tough. It contains bundles of collagen fibers. So you can see the bund of collagen fibers in bundles, and you can see rows of nuclei here, or sorry, not nuclei, the cells. So that's the chondrocytes. And this is normally seen in the intervertebral disc. What do you mean by the intervertebral disc? Yeah.
Oh,
Say that again?
In between.
In between the? Not the knees, the intervertebral, between the vertebrae. So between two vertebrae, there's a disc made of fibrocartilage. It is to prevent the discs from hitting each other. It's like a cushion, but it's a strong cushion. So it acts as a shock absorber. So when you're jumping, you're walking, it's always coming into contact. So you need a proper cushioning there. So basically we said hyaline cartilage is for the joints. Elastic cartilage is mainly providing the flexibility, and fibrocartilage is providing the shock absorption. Bone. What is bone? It's hardened connective tissue. Again, it is connective tissue. It fits with the description. Cells in a matrix. That's what bone is. The only thing is that the matrix is hard. Why is it hard? Because it's calcified. How does it get calcified? Calcium phosphate crystals go and deposit there. And that's why bone becomes hard.
Vitamin D has nothing to do with that?
Yeah, vitamin D has got a role there, and we have to go into a lot of details about the vitamin D, because that'll be the clinical aspect. We'll come to that. Two types of bone tissue. So inside a bone, there are two types of bony tissue. There's a spongy bone and there's a compact bone. Spongy bone is found on the inside. Compact bone is found on the outside. So spongy bone has got a honeycomb appearance. See this honeycomb appearance here? This is actually the skull bone. And over here, you can see over here, oh, let me move. Okay, oh, you can see it here. You can see at the end, there is spongy bone. If I move, yeah, here you can see it. This is spongy bone. It's on the inside. Compact bone is seen on the outside. So this outer layer is compact bone. The compact bone is providing the strength. What is the structure of a compact bone? This is very important because you're going to see the bone in the lab. So the compact bone consists of units called osteon. Osteon, this is an osteon. This one unit is called an osteon. So in an osteon, you can see there's a central canal. This central canal is surrounded by rings, like a tree. If you cut a tree, you can see has got a lot of rings, right? And it's the same structure in a bone. There's a central canal surrounded by rings. What's in the central canals? Blood vessels, that's where the blood supply comes from, and also nerves. And surrounding this, there are concentric rings of bone, but you see some spaces here, and inside the spaces there is something. That space is called lacunae, just like we talked about in cartilage. Bone has got a central canal surrounded by concentric bone formation, and inside there are spaces called lacunae. And who is living inside the lacunae? Actually, chondroblast produces the bone, and then when it matures, it is called a chondrocyte. So what lives in the lacunae? Chondrocyte. Again, so the lacunae here is, from here you can see little tiny little fine little finger-like projections. So all these lacunae are interconnected. And these tiny channels are called canaliculi. So the canaliculi connect the lacunae, so the bone gets the nutrients. Let's move on. Blood. Blood is connecting tissue. Fits with the definition. Cells suspended in a matrix. And I told you plasma is the matrix. The cells are red blood cells, white blood cells. What does the red blood cells do?
Oxygenate the blood.
Oxygen. They carry oxygen. What does the white blood cell do? They fight. They are your defense. They are your soldiers. And what does platelets do? Blood clotting. Correct. And here in the lab, you're going to see these white blood cells. This is a neutrophil. You can see it's multilobulated lymphocyte. Here you can see the erythrocyte, which is a biconcave structure. This is a monocyte. These are the different types of blood cells. Now let's move on to nervous tissue and muscular, the excitable tissue. What do you mean by excitable tissue? Those,
They conduct electricity.
no, they are excited by some changes. So a nerve is excited by an external stimuli. Well, so you can have a change in the electrical charge of the nerve cell, and immediately it will recognize it as a stimuli and it will fire an impulse. So that's what's happening in your brain. In your brain, you are thinking of doing something, and there's a change happening inside there. And that electrical change is immediately recognized by a neuron. The neuron is firing immediately. And that impulse is going all the way down. And we're going to learn how it's going to move and all. But for the time being, understand it's going to move to the concerned muscle, make that muscle contract, and have the work done. Again, the muscle also. Usually the nerve is connected to a muscle. It's called a neuromuscular junction. So all these impulses start from there, moves through the nerve, reaches the muscle, something happens there, the muscle decides to contract. They are excitable. So if you look at nervous tissue, they're really specialized for communication. There are three main players: neurons, neuroglia, and it's actually the neuron has got some parts. So let's say neuron and neuroglia, out of which neuron is the main player. The neuron detects the stimuli, it processes the information and transmits the information to the other cells. Neuroglia, or glial cells, they are like the housekeepers. They assist the neurons. They have an important role, but they're not the main players. Structure of a neuron: it contains a nucleus. And what this part of the neuron, the main part or the cell body, is called a neurosoma. It contains a nucleus and it contains some processes. You can see these processes. One of the process or one of the extension is very long, and that's called an axon. The axon carries impulses away from the nucleus. And the dendrites, these are the dendrites, the short process, they carry impulses towards the cell body. So you have dendrites and axons. Muscular tissue, mainly movement, right? Life is about movement. It's not only when you're walking and doing stuff that you're moving. When you're sitting still, there is still movement happening. Your heart is moving. Your digestion is moving. A lot of movement happening in the body. All done by muscle cells. Now, what does the muscle cells do? They contract. That's what creates movement. Even when you're not walking, you're maintaining your posture. That again is muscle movement. Three types of muscles: skeletal muscles, cardiac muscles, and smooth muscles. Skeletal muscle, that's what we refer to normally. These are the muscles that you use when you go to the gym for pumping iron. And when you look at under the microscope, you can see they have long cylindrical cells. And these cylindrical cells are called muscle fibers. So a muscle cell in a skeletal muscle is called a muscle fiber. So this is a muscle fiber. This is another muscle fiber. And what's the peculiarity here? This cell has got not one nucleus, it is multinucleated. It's got more than one nucleus. So cells could have one nucleus, which is normal. Some cells have multiple nucleus. And a classic example is the skeletal muscle or skeletal muscle fiber. So you have to remember the cells of a muscle is called a muscle fiber. Again, there is one peculiarity here. What do you see here? You see striations, you see lines, and you see that in the model in the lab, right? So when you see the striations, you see these muscles are cylindrical, and when you see multiple nuclei, you immediately say this is a skeletal muscle. Cardiac muscle, only seen in the heart, nowhere else. The cells are called cardiomyocytes. Peculiarity is it has something called intercalated disc. That is the distinguishing feature. So between two cells, one cell is connected to the next cell through this junction called intercalated disc. That's only seen in the cardiac muscle. If you look at a cell, it has got only one nucleus. And cardiac muscle is striated. But is it under your control? No. Skeletal muscle is striated, but it's under your control. You want to move your finger? So what do you call such muscles? They are voluntary muscles. Muscles you can control are voluntary muscles. Muscles which you cannot control are involuntary muscles. Smooth muscle. Why is it called smooth? No striations. The cells are like spindles, see? They are spindle-shaped cells, single nucleus, and they are usually seen in the internal organs like the stomach, intestine. They are seen in the visceral organs. Are they under your control? No. You cannot control your digestion, the movement in your stomach.
What about your diaphragm then?
Diaphragm is skeletal, is under your control. Yeah. Okay. So cells are connected to each other through junctions. There are 4 types of cellular junctions. There's a tight junction, which means the cells are tightly connected to each other. Or there could be a desmosome. That is where the cell is anchored to the basement membrane. So if you think about the skin is separated from the underlying layer, and there's a membrane in between. That's a basement membrane. So the epithelial cells or the epidermis is sitting on a basement membrane. And under the epidermis is the dermis, right? So the separation between the dermis and the epidermis is the basement membrane. It's like the base. And what anchors the cells to the basement membrane is desmosomes. That's a peculiar type of cell junction. And there are gap junctions. So the gap junctions help the cells to communicate with each other. Because cells have to communicate with each other because they all are working together for a common purpose. So when you have cells working together with a common function, what do you call those group of cells? A tissue. When you have groups of tissues with a common purpose, what do you call that? An organ. And when you have multiple organs performing a particular function, that is an organ system. And when you have multiple organ systems coming together, you have an organism. Let's have a look at glands. Glands are organs that produces secretions. We have two types of glands. We have exocrine glands and we have endocrine glands. Exocrine glands produce secretions and they have ducts. So the ducts carry the secretion to, for example, let's say you have a sweat gland. So sweat gland is produced in the skin, and from there the secretion is brought to the surface of the skin. That's why when you sweat, you see all these beads of sweat coming up. So the secretion is taken through the duct and it's carried to the surface of skin. Whereas endocrine glands, they have no ducts. So the secretions are pushed into the blood. And the blood carries it wherever it has to go. So that's the difference between exocrine and endocrine. If you look at the secretion of exocrine glands, there are three types. There is serous secretions, which is the thin, watery secretions. And then there is a mucus secretion, which is a thick mucus secretion. Mucus is thick. And then you have glands which are mixed, which produce both. Most of the glands are mixed. And if you think about the secretions in this area, which is the main secretion in the mouth? Saliva, right? So there are multiple glands, but there's a parotid gland here. And parotid is actually, I think it's parotid is a serous gland. It produces serous. Then you have a gland here, submandibular gland. That the secretion of the submandibular gland is mucus. And then you have sublingual gland, which is under your tongue. They are mixed. When I say one is serous, it doesn't mean that it is completely serous. It is predominantly serous. So most of the glands are mixed glands, but there is a predominant component. Exocrine gland release their secretion by three different methods. The most common method is exocytosis. We learned about exocytosis. So what they do is that they fill and they make an opening and they boom, it goes out. Tear glands, salivary glands, and sweat glands. And then there are apocrine glands. They pinch off a piece of their cell apex and they come out. Well, actually, now they think that there's nothing called the apocrine glands. They are the same as merocrine, like this is merocrine secretion. And then there's what is known as a holocrine gland. This gland fills up entirely and then it bursts. And that's how sebaceous glands work. What does sebaceous gland produce?
Pus.
No. Oil. Sebaceous.
Like
sebum. Yeah, sebum is oil. So some people are oily. You have an oily, a lot of oil in their skin. And that is because they have more sebaceous gland, oil producing glands. So that is a classic example of holocrine glands. The gland bursts, so it fills up, bursts, and releases the secretion. Let's touch on tissue growth. Tissues grow all the time. There can be two types of growth. One, there could be an increase in the number of cells. That's called hyperplasia. And then number two, there could be a growth due to an increase in the size of individual cells. That is called hypertrophy. A classic example of hypertrophy is the fat cells. Fat cells just increase in size. Yeah.
A random question. Can fat cells burst?
No. Why do you think it'll burst?
Yeah, just because of the holocrine gland.
No, fat has no. There's no. I mean, we are talking about sweat glands. It's a gland. So when you said fat, you didn't mean a gland. You meant fat, right?
Yeah.
Yeah. Fat is a tissue. It's not a gland.
Okay.
So that is how tissue grows, by two processes, hyperplasia and hypertrophy. Muscles, another classic example of hypertrophy. When you're going to the gym, your muscles become bigger, not because there's an increase in the number of muscle cells, but because there is an increase in the size of the muscle. Each muscle cells become larger. That is hypertrophy. Hyperplasia means increase in the number.
So hyperplasia would be more with the brain cells, and then hypertrophy would be with.
Hyperplasia is what you see in the skin. It's constantly producing a lot of cells. And that's how this it goes to the surface, it exfoliates. There's a lot of.
In your brain producing cells?
Brain actually produces a lot of, there's a lot of growth in the brain up to a certain age. By about 6 years, a child's brain is the same size as adult brain. After that, the growth is very, very minimal. So, yeah.
The spontaneous or the production of brain cells doesn't happen.
No, doesn't happen. But connections happen.
Oh, okay.
Yeah, connection. That's what memory is all about. Memory is all about the neurons connecting. Connections happen. That is a very active process. So if you want to increase your memory, you want to increase those the cells, which is the neurons, connect. Number of cells is constant. And the opposite of growth is atrophy. Atrophy means shrinkage. It could be a loss of the cell size. Cells can become smaller, or it can be a decrease in the number. What do you mean by necrosis? Cell death, yeah. Cell death is necrosis due to injury, toxins, all these things. Infarction. Have you heard about myocardial infarction? MI, heart attack. What is an infarction? Yes, death of a tissue because of lack of blood supply. Mhm.
So when someone had a heart attack.
Yeah.
And they have to recover, or like the cells have to like reproduce the mitosis?
No. What is happening? Infarction is happening there because the blood supply to the brain gets clogged, or usually it's something called it's fat collection. Okay, so the fat collects and the blood vessel gets clogged, so the blood supply is cut off. So that part of the heart does not have enough blood supply. It goes into infarction, into a death. That's called myocardial infarction. Okay? MI. So the person has a heart attack. Now, how does that recover? Now, when there's an infarction, what happens is that there is an area of scar tissue. that's not going to recover. That's going to be scar tissue. But what happens is that collaterals develop from the blood vessel and start supplying the other areas, and that area will start overworking and compensating for the dead area. The dead area will never regenerate.
But it makes more blood vessels to compensate.
There's always collateral supply developing in case of a myocardial infarction.
And is it, that's why they make, give the pacemaker sometimes?
Pacemaker is for the rate. So the heart has got a rhythm. And that rhythm is controlled by some tissues inside the heart called the pacemakers. So there are pacemakers, there's a AV node, SN node, there are different pacemakers inside the heart. And when that pacemaker stops functioning, you have to put an external pacemaker. So that's pacemaker is for the control of the rhythm.
You're like, or this one atrial.
Yeah, SA. So we'll be talking about the different pacemakers in the heart. There are different pacemakers in the heart. All are of different rhythms. We'll talk about that a little bit. Yeah. Now, before there are stem cells in the body. What do you mean by a stem cells? You might have heard about stem cell research. What is a stem cell? It's a cell that can become any type of cell. That's a stem cell. And when a cell changes from one type to the other, that is called differentiation. So a non-differentiated cell or a stem cell can become a specialized cell. Once it becomes a differentiated cell or a specialized cell, it will only do that particular function. Whereas a stem cell can become any cell, but a differentiated cell can only give rise to that particular type of cells. And this process of changing from one type of cell to another type of cell is called metaplasia. So if a person is a smoker, all your cells which are squamous cells can change due to the effect of smoke. So that is a metaplasia. The change of the one type of cell to another type is metaplasia. So if you have an injury, what happens? There will be either there could be a regeneration or there could be fibrosis. What do you mean by regeneration? Regeneration simply means that that particular injury is replaced by the same type of cells, so that normal function is restored. What do you mean by fibrosis? Scar. It's replaced by scar tissue, which is not going to function like normal. And a classic example of regeneration is the liver. Liver has got an amazing capacity to regenerate. So if you have an injury in the liver, it can regenerate. Also, small injuries in the skin can regenerate. But if you have a big injury in the skin, it will not regenerate. It will form scar tissue. That's why if you have a big cut, you'll end up with a scar. Usually burns and all, they end up with a lot of scarring. So when you have an injury, what's happening? First, you have a bleed into the wound, and then that bleed will clot. So you have a clot, and the clot is later converted into something called granulation tissue. So what's happening in the granulation tissue? Inside the clot, there's a lot of fibroblasts being produced. A lot of capillaries are produced. And then you have something, what is known as a soft granulation, which is a combination of fibroblasts and blood vessels, new capillaries. And later, that granulation tissue becomes scar tissue because it has to hold the cut ends together. So scar tissue forms. And that scar tissue later, the scar tissue is very hard. So initially after a wound, you can see the wound is very hard. It's healing, it becomes hard. And later there's a remodeling happen. It softens. But it does not become the original contour. But a lot of things happen over time. We are moving a little bit with the skin. So let me open, let's see, integumentary system. Let me just pause for a second.
Are you're a medical doctor?
Yeah. Assume. Share. Let me see. Share. Yeah. I think we're sharing the correct one. Yeah. Right. Okay. So the reason why I'm moving a little bit with this one is because this is in your lab. So it'll help you a lot. So, and also this is, part of the course. So I'm going to utilize the next 20 minutes for the integumentary system. Let me put it into full mode. Stop share. Come on. Okay. So this is chapter 6, integumentary system. Come on. Okay. So we're talking about the skin. So what's your concept about skin? It's like a covering, right? For your body. It's really the interface between you and the world. Thickness of skin, 1 millimeter, 2 millimeter, that's all. But it covers a big area, right? About 2 square meters. Weight of the skin is actually the biggest organ in the body. But when you talk about skin, you also have to talk about the nails, hair, cutaneous glands, and all together, we're going to call this the integumentary system. So we are going to talk not only about the skin, all the associated parts. So we said the skin has got 3 layers. There's the epidermis, there's a dermis, and below the dermis, we have hypodermis. Hypodermis is usually made of fat. Epidermis is made of stratified, squamous epithelium. Dermis is made of connective tissue. So you might have been in the lab and you're looking at the skin and you see adipose tissue. Is that normal? It is not. Yeah. Because if you are at the bottom layer, you will see adipose tissue. If you are above that, in the dermis, you will see what's the tissue which epithelium rests on? Yeah, it rests on, but under the basement membrane. Areolar tissue. Most of the epithelium rests on areolar. So you're going to see all this tissue in the skin. Okay. So the secret of seeing the epithelium is that you have to go and reach the surface of skin. After that, it's air. So if you hit that surface, so many of you in my lab yesterday, you were in the bottom looking at adipose tissue. So you have to reach the surface. So three layers: epidermis, dermis, and hypodermis. Epidermis peculiarity, avascular. Okay, don't forget that. How do they get nutrients? By diffusion. On the surface, you have this keratinized, stratified, squamous epithelium. What does that mean? Multiple layer of cells, stratified. Squamous is flattened cells. And these cells, which are flattened, are also packed with keratin. That's why it's called keratinized. Does it make sense? Okay. Don't be overwhelmed with the big names. Okay. But there are 5 types of cells in the epidermis. There are stem cells, which is the basal layer. The basal layer is also called stratum basale or basal. So the British like to call it basal, and the Americans call it stratum basale. So that's like a stem cells. They produce all the type of cells. The most abundant type of cells in the skin is keratinocytes. And keratinocytes produce that protein called keratin. And that is what waterproofs your skin. Otherwise, you're going to lose water all the time. Then there are melanocytes, which produce melanin. Melanocytes, good or bad? Good, because it protects you from, yes, UV radiation, which causes cancer. Number of melanocytes, is it constant in all the people? It is. The number of melanocytes is the same.
Some are.
Yes, we'll come to that. The difference is that it's in a dark skinned person, it is more active. And also the distribution is more wider. There are more reasons, I'll come to that. And the skin has got tactile cells. What do you mean by tactile? If you touch your skin, you know it. If a little insect crawls on your skin, you'll know it. You immediately go and you tap it. Why? Because there are nerve endings and there are receptors. The receptors, when it is stimulated, fires. Those signals pass through your sensory nerve, reaches your brain, tells you there's something on your skin. So those are the tactile cells. And then there is dendritic cells. Dendritic cells are your fighters. They're the soldiers. They fight pathogens. What do you mean by a pathogen? The disease-producing agent is a pathogen. It could be a bacteria, virus, whatever. Again, in your body, you have thick skin and you have thin skin. Where do you see thick skin? Yeah, sole of the foot, palm of the hands. That's where you see thick skin. And that's the area where there's a lot of wear and tear. And there's thin skin in the rest of the body. What's the difference? Thick skin has got 5 layers. Thin skin has got 4 layers. The extra layer in thick skin is called stratum lucidum. Okay, so the layers of the epidermis are stratum basale. We talked about that. So that is this layer here. This is a basale or basal layer. And above that, you have the spinosum. So this is a spinosum. And above that, you have the granulosum, stratum granulosum. And above that, you have the stratum lucidum. And then above that, you have the stratum corneum. Let's talk about each type. Stratum basale. That is the deepest layer. So this is the bottom of the epidermis. And you can see one layer of cell here. This is the stratum basal, the basal or basal layer. It's actively dividing. It is stem cells, so they can become any cell. Okay. It can become keratinocyte. It can become melanocyte. It can become a tactile cell, or it can become a dendritic cell. The next layer is a stratum spinosum. Spinosum means spine. So here, the most abundant number of cells is the keratinocytes, and they are joined with each other with little connections, and it looks like spines. So if I just increase the size, can I? No, I can't. No, I thought I could. No, I can't. So if you look here, there are spines in between connecting two cells. That's why it's called stratum spinosum. It's got a spiny look. And this layer also contains dendritic cells. This is a dendritic cell here. And it also contains melanocytes. Stratum granulosum is above the stratum spinosum, and it contains keratohyalin granules. And that's what becomes keratin. Why do you need keratin? Keratin fills the cells and makes it waterproof. Yes. Waterproofing the skin is by keratin. And above that, you have the stratum lucidum. This is only seen in the thick skin, stratum lucidum. And this stratum lucidum is packed with a clear protein called elidin. And on the top, you have this layer called stratum corneum. It actually is about 30 cell layers thick, and it contains flattened keratinocytes. So the keratinocytes, when they are at the bottom, they are quite big. And as the cells in the bottom produce more keratinocytes, they keep moving up and up. And as it goes up and up, they become more and more flattened. They can become filled with keratin, and they are packed with keratin as they reach the surface. They are dead cells. They reach the surface and they flake off. It's a constant flaking off, and that's what's called dandruff. Another few minutes. Let's move as much as possible. So if you look at a keratinocyte, if you look at the life cycle of a keratinocyte, where is it produced? In the basal layer, stratum basal, okay, or basale. That's where it's produced. Over time, it moves from the bottom to the surface because new and new cells are produced at the bottom. So it's pushed to the surface. And when they move, what happens? They become flatter. And they are packed with keratin, the protein called keratin. So finally, they will flake off. And this life cycle is 30 to 40 days. So it's a constant renewal process. Now, we talked a lot about that the skin is waterproof. What makes it waterproof? We said that one is the keratin. The keratin produced by the keratinocytes is a water barrier, number one. But again, there are a couple of other reasons. One is the tight junctions. So the tight junctions between the cells will prevent water loss. And the third one is because there's the keratinocytes, they release like a sealant, which is actually a water repelling lipid. And this also, it's like a structure which is sealed. So this water repelling sealant produced by the keratinocytes is another factor. And that's a major factor which prevents you from getting dehydrated. So that's all about the epidermis. Let's talk a little bit about the dermis. Dermis is under the epidermis. So the next layer is the dermis. And unlike the epidermis, it is packed with blood vessels, nerves, sweat glands, sebaceous glands, oil glands, nerve endings, all these. You can see it in the dermis. The hair and nail roots are anchored here. And if you look at the epidermis and the dermis, you can see the junction is kind of wavy. So you can see this wavy junction. And when you say it's a wavy junction, that means there's a projection downwards from the epidermis and a projection upward from the dermis. The projection downward from the epidermis is called an epidermal ridge. And the projection upward from the dermis is called a dermal, what is that called? Papilla, dermal papilla. Yeah. So it acts like a zipper. And the reason for this particular arrangement is that it makes that connection stronger, and it also increases the surface area. Because I told you the epidermis is avascular. It gets all its supplies from below. So you need a big area for all the material to diffuse. And one more thing which I of interest is the, well, what do you call the fingerprint? So you go somewhere, they will take fingerprints of you, which is like unique for each person. This fingerprint is produced by the downward projection of the epidermis, the epidermal ridges. That's what produces the fingerprints. Okay, let me just finish this epidermis and we'll stop. So the dermis has got two layers. There's a papillary layer, which is just under the epidermis. It's thin. And it is also, there's a lot of areolar tissue, which means there's a lot of spaces, there's a lot of blood vessels. And under the papillary layer, there is a reticular layer. And this is made of dense, irregular connective tissue, which we discussed earlier. The dense, irregular connective tissue has got fibrous connective tissue, but they are in different directions. We talked about the dense, regular connective tissue, which is seen in the intervertebral disc. That is like a shock absorber. It contains fibroids, but they are parallel to each other. Here, they are in different directions. So in the skin, you're going to see all these things in the skin, okay? So we'll stop here and we'll continue with the hypodermis in the next class. All right, you're welcome.
Is there a diagram?
Oh, yeah, there is, yeah. Please take two and I'll give you one more. Just put the date here.
Give me a working thing or
Just give me 1 second. Let me stop it. Otherwise, stop recording.